I'm Bill O'Reilly. Thanks for watching us tonight. Here comes socialism. That is the subject of this evening's Talking Points memo. With Obamacare descending into chaos, the president and the Democratic Party are in a perilous place right now. Americans are starting to figure out that the government-controlled healthcare industry is likely to be a nightmare on many fronts. So why won't the feds fix this situation before imposing it on we the people? The answer is that Obamacare is just part of a vision for the forced sharing of American assets. The strategy is largely kept quiet, but there have been hints.
The great civil rights issue of our time, and that is the need for every man, woman, and child to have health care as a right and not a privilege.
I believe health care is a civil right.
Although health care was not listed per se in the Constitution, it should be a constitutional right.
You do have the right to health care and to education and to decent housing.
Ms. Perry's point of view is a socialist communist vision that the state should provide all citizens a certain lifestyle at the expense of other citizens. If health care is a constitutional right, then everything associated with good health would fall into the civil rights category. So your entire environment, house, food, clothing, transportation, mental health, would all have to be paid for by the state if you could not afford it. That's a form of communism because no country could afford those payments without seizing the assets of everybody else. It's impossible. Right now, the USA has a debt of $17 trillion and growing. Some of that debt is because of wars, but most of it is providing entitlements and infrastructure, things like roads, water, police protection. And we Americans pay taxes to have those things. But here in the USA, there is a subculture of people who are uneducated, unskilled, and or have mental health problems like addiction. Those people cannot or will not provide for themselves. And that situation is growing. In order to provide for the have-nots, the far left wants the federal government to seize the assets of solvent Americans. That's what Obamacare is all about, taking from those who can afford health care to provide to those who cannot. No matter what the reason for the insolvency is, it doesn't matter. By the way, the emergency room situation where hospitals are mandated to treat anyone who walks in for free, that's not going to stop under Obamacare. That expense, estimated to be $4.5 billion a year, will just be added on to the colossal cost of the Affordable Health Care Act. Ironic, isn't it? Talking Points believes that most Americans don't understand what the deuce is going on in this country. Slick politicians on both sides can easily obscure the truth. But the truth is that the USA, at this point in time, can't afford to pay for Obamacare unless working Americans give up more of their assets, in some cases, much more. And that's a memo. Now for the top story tonight. The Impact segment tonight, providing a lifestyle to all Americans. Here now, Fox News analysts Monica Crowley and Alan Colmes. So, Colmes, is health care a constitutional right?
It is not, because it's not in the Constitution. But I think it should be. I think it should be a human right. FDR said everybody should have the right to adequate health care. Half of the countries in the UN have it. Uruguay has it. Latvia has it. We don't have it.
Okay.
It makes us a less advanced country.
If, say, there was a constitutional amendment to include health care as a basic constitutional right, which would take 2/3 of the states to ratify, then by extension, you'd have to have good food guaranteed because you couldn't be healthy without good food.
Well, I don't think it's
going to... No. Stay with me. Good food guaranteed by the federal government.
I think food, housing, and I believe that health care should be everybody's right.
Okay, so health care, food and housing. Good housing.
Nobody in this country.
Not slums.
No, you don't have to live in a high-rise overlooking Central Park.
No, but decent, not slums. Good housing. All right. So you're a communist.
I'm a communist.
Yeah,
no,
you are. Because you couldn't possibly pay for all that.
Yeah.
It's impossible.
In many countries, people who can pay. People who don't pay get health care. The way it is going now, here's
what country are you referring to?
Uruguay, Latvia.
Uruguay.
Countries that are considered
I don't think they guarantee good food in Uruguay.
No, but they guarantee health
have you been to Uruguay?
Not lately.
I have.
They guarantee
Believe me, they're not guaranteeing good housing in Uruguay.
But they guarantee health care. And here's where you're wrong about it being socialism. What we have now is socialism. Those who have health care, those who have insurance, are subsidizing those who don't. That's socialism. Obamacare.
Well, they're but you want to take it 10 steps further. All right, let's get Ms. Monica in here.
Is access to health care a civil or legal right? That's the question you posed. No, it is not. However, it's not that in the sense that free speech is a legal right and so on. However, the richest country in the history of the world, the United States, it doesn't need to be a right because we have made a social compact over many decades to take care of the least among us. So when you talk about access to health care, when you talk about education, when you talk about public housing, we as a collective society provide all of that already to those who are most in need.
But we don't provide.
You don't need to enshrine it in the Constitution.
We don't provide good housing to people.
There's public housing. You can debate whether it's good or not.
Have you ever been to public housing?
Bill, would I want to live in public housing? No, but if somebody
in a lot of places
is really poor,
wait.
there is housing.
That's not the division.
Bill.
Wait a minute. In a lot of places, public housing is dangerous to your health, number one, okay? It's dangerous to live there.
That's a separate question.
Number two,
that's a totally
what Colmes
separate
wants
question.
and his ilk, they want good housing, good food, not food stamps where you go in and buy Pepsi and potato chips.
Right.
Guaranteed.
Not
Guaranteed.
truffles.
So you can't tell me, and the only guarantee of health care we have is emergency room care here. That's the only guarantee.
No, Bill, what are you talking
if you
about?
walk into Dr. Welby's office and you can't pay Dr. Welby's bill, Dr. Welby's throwing you out. But it's emergency
actually,
care.
he has an obligation to treat you in this country. Yes,
not unless you're in an emergency room.
You walk into an emergency room, the doctors have to take care of you.
That's
Bill,
the
we
only
have
way.
a gazillion government social welfare programs in this country. This is before Obamacare. Medicare to take care of the elderly, Medicaid to take care of the poor. If you are completely broke, you can walk into an emergency and get care.
Do you believe
There's
that
WIC
Colmes
for women and their babies? We have so many social safety nets in this country.
But they're not at the level
that nobody in this country
not
without
at the level of
going
what
without care.
They're not at the
Bill,
level of
not everybody can live on Fifth Avenue.
Am I going to ask you the question tonight?
You're making an argument about.
I'm not making any argument. I'm challenging your argument. Now, do you believe Colmes is a communist for advocating good housing, good food, and a lifestyle that can only be paid for by those who have money?
Well, that argument, I'm glad to see.
Do you believe he's a communist or not?
Sort of, yeah, actually.
Okay.
But wait a minute.
No, you've had your say.
Sort
of is the answer.
It's so nice.
Now back to you.
Red baiting is alive here.
Back to you. Not red baiting.
Yeah.
It's a description of a political philosophy.
Communism is an economic system. I'm a capitalist, but I also believe the government should step in when necessary in order to give a basic service to those who can't afford it. But here's the problem. In the emergency room, it costs too much money. The way we're doing it pre-Obamacare is too much money. With Obamacare, more people in the system. The same thing Romney did in Massachusetts. Everybody, let me finish, please. Everybody paying in, it costs less for everybody. Like New York State, where premiums are going down in half. That is what's working in New York State.
No. You don't have to say anything. I can answer. As somebody who knows Massachusetts very well, the Obamacare, the Romney care system, all right, has strained them. They can't even treat the people. People are going from the Bay State to other states to get treated because of the government-imposed regulations. So that's the truth.
Let me tell you what Obamacare does.
No, I don't want you to tell me anything. People can go read and decide. But I do think Colmes is a communist. I do. And I'm going to get you a little
red hat. Let me make a point on that communist thing, okay? The fact is there are exchanges in every state where there is competition. What Obamacare does in these states is actually...
We're taking it further than that.
It's free market competition. What conservatives claim they like.
We're taking it into the good housing, food, an umbrella if it rains, little booties if you need them if it's cold.
That is free competition the way the free market conservatives like.
I have no idea what you're saying, but all right. Thanks very much for a good segment. Directly ahead.